Hello, welcome back to Empowered Training Solutions. So we shall be discussing briefly how do we order medicines, how do we receive them, and of course the storage of drugs and health supplies within a health facility. Now, ordering, of course, you need to prepare a list of items to be ordered, because this one to be procured. And then from the list above, you include quantities, unit cost, total cost, and then you cost the entire order. After that, sometimes the money may not be enough. You adjust the cost based on vein and the available budget. Now, of course, you finalize with the list and then you submit an order. There are steps which you need to consider here, because vital drugs should always be on the list. However, you can remove others and adjust the order. Of course, now after placing the order based on the procurement method you agreed upon, as earlier discussed, after that you receive the medicines or the health supplies. Of course, in receiving, one thing that is very important in receiving of drugs or supplies is the documentation. Ensure you receive the right drugs or right health supplies. The document should tally with your facility. And of course, at receiving day, you need to look at the note, the invoice, copy of the order, packing list. So that is what you have to do. Now, what are the receiving procedures? Of course, you need to quarantine the incoming stock. Now, in case of large, once you upload from the truck, you quarantine the stock in some small holding area. Of course, you need to check the documents, as I said above. Sometimes you sample. You can sample the item to see their quality. Now you need to inspect the quantity. If there are liquids, are they leaking? You need to inspect a lot. Are the capsules proper? Are tablets broken, chipped? All this. Now of course you need to report any discrepancy from inspection. Maybe if in case the quantity is not enough, in case they are near expiry, all these ones are checked. And then by filling a discrepancy, report. After that, you update the records and then you release for storage. Simple as that. However, your facility could have a different mode of receiving medicines or health supplies. For example, in a pharmacy, anyway, you need all this again. Now, storage of medicines. How do you store medicines? Of course, storage ensures availability of items and prevents loss due to theft and damage. Of course, the store should be spacious enough. Sometimes these large stores are zoned. Of course, we know the zoning, what I'm talking about. You have liquids, you have tablets, you have the heavy ones are palleted on pallets, and they have the controlled drugs. All these ones. Stores should have strong shelves to handle these drugs. Some of them usually metallic. This one, of course, we know them. Others are wood in nature. Pallets are used to avoid items getting into contact with the floor, because we know they could absorb moisture, leading to deterioration. Of course, ensure appropriate conditions are maintained within the stores. That means appropriate temperature, humidity. Now, of course, in case the temperature reaches is higher than the required for drugs, especially in a general store, which is usually between 20 and 30 degrees Celsius, you can open windows or you can use fanning to cool down the place. Of course, you need to avoid direct sunlight by using curtains in the windows. Free from pests. Ensure that you don't eat from the store. Some of us have habits of eating in stores. Of course, in case anything spills, it can attract birds, cockroaches, all this one. Now, ensure there is fire prevention. Those fire, what are they called? The fire extinguishers. And each employee in the pharmacy or in the store should be taught how to operate them, because in the case of an emergency, people should be able to handle them. Cleanliness is key. It should be clean, and these records should be maintained. In case it's a pharmacy, this is a general store, there's no general store, should be cleaned every day. and of course security. Now, of course, what I missed, the records which are supposed to be kept, the temperature and humidity records. These are supposed to be recorded at least 3 times a day. And that record sheet should be always there, whether you are in a general store or within a pharmacy. Usually, National Drug Authority inspectors, they look for these records. Now, stock handling. Of course, how do you handle stock? Of course, you can use shelves, and we have talked about it. Secure storage spaces, and then you can use pallets to avoid on the items being on the floor. Now, of course, which are those methods used? Of course, we know we can use manual labor to carry the boxes. Sometimes we use trolleys. Now, in case we're in large stores like maybe JMS, NMS, of course, we use handheld movers. There is handheld movers or hand-operated hydraulic pallet lifter, or sometimes we can use forklift trucks. Forklift trucks. These ones are in large stores, but for us in small hospitals or big hospitals, we use our casual laborers. Even us, sometimes we have to take part in lifting of these drugs. Now, of course, now you need to store them. Of course, if they are medicines or drugs, you use FIFO system. Because items with near expiry date should be dispensed. Or should be put in the front, either they can be accessed and dispensed. Now, if you can have a dilemma where you receive a product which is of a near expiry, and the one which you had in stock has a long expiry. So what do? Of course, you have to use FIFO, because the moment you make an error and dispense the other which you had, what if the other expires on you? Again, you have more losses of expired. Now, because our FIFO. Now with FIFO, it's first in, first out. This one applies with items with no expiry, the expiry date. Of course, newly placed items are placed behind the other which have been in stock. Of course, stationery, clothing, and very many others. Of course, let us look at different zones in a pharmacy. In a pharmacy or in a general store. We have the general storage area, at least less than 30 degrees Celsius, and humidity of this. Sometimes we have cold storage. These are of course in refrigerators for keeping cold chain items, 2 to 8 degrees Celsius. We have secure storage. These are the cupboards which are always under lock and key. Can also have those ones for expired drugs and narcotics. All those ones, they should be designated place within the store. Flammables, in the case you're a large pharmacy store dealing in flammables, they should be stored separately. Of course, stock can be in fixed location. Of course, all of us we know this. In pharmacies we work in, even these shelves are labeled that duocotoxin is here always. Fixed location. Location is known. In case the item gets finished, you don't put an item in that location. You leave it blank. We have fluid location. The spaces in the feed location method. Here, the spaces for storage may change. If paracetamol was here, tomorrow it may be in another location. So may also happen. However, there's also semi-fluid. This is a fixed location. So in case one item is consumed, you don't leave the space blank, but you bring another item and you place it there. The location. Of course, I'm sure we are all following. Of course, remember this is a short presentation. Stock management. Well, it has sort of stock arrangement. How is stock arranged within the pharmacy? Of course, we know that they can be based on therapeutic category, antibiotics, antifungals, alphabetic order based on the names, dosage form. We have tablets, capsules. What here? Sometimes the random bin. Now these are shelves with the unique codes. These are mostly in big facilities, in the big stores. Random bin where shelves have unique codes and each item is known with that code. This one is in A1. Paracetamol is in maybe P2. Now commodity coding. This is a computerized system. This is a computerized system. This is again in large stores. However, most of us in community pharmacies or hospital pharmacies, we use frequency of use method. Now, in frequency of use, you don't mind about this, but items which move very fast, they're even placed near the counter. Even some patients come and just point. The other one. We know those drugs. So frequency of use. Of course, these ones which are used very fast are placed near. And of course, in the shelves, you use the methods above. These are the other presentations in pharmacy practice that we have organized. You can always refer to them. Always remain Wilson from Pharma Training Solutions. You can always contact us for more information, or you can refer to standard books. Subscribe to my channel in case you haven't subscribed. Like a video, leave a comment, give a thumbs up. Send us a comment on how you can improve. Thank you very much.